This misalignment is the axis misalignment of the ALS. Now, with the difference between the listing system, Dr. Blair was ingenious in this aspect where he transposed the second letter in our listing system. In our atlas, we would have said ASL. For the axis misalignment, we say ALS. And this is just a little thing to make sure that the doctor doesn't mix up the adjustment, to make sure that when an axis adjustment is called for, that we're doing an axis adjustment. Now, what's happening in the way the listing system works is that we're listing the spinous of the vertebrae. And if we have a spinous right, that can happen in one of two ways. One, we can have the right lamina move forward. We can also have the left lamina move backwards. Both left lamina moving posterior or the right lamina moving anterior will create a right spinous. If the right lamina is moving forward to create the misalignment for the right spinous, we say anterior right superior motion as the bone's coming up that right articulation of C3. If the spinous has gone to the right due to the posterior movement of the left lamina, this is a posterior right inferior motion into the vertebrae. If we have a left spinous, the left spinous can occur by the left lamina moving forward and anterior and superior, or the right lamina moving posterior and inferior, shifting the spinous to the left. This misalignment we have taking place is the left lamina has moved forward, shifting the left spinous. We have an anterior left superior misalignment of the C2 vertebrae on C3. We're going to take a measurement of the superior articulating surface of C3, which we would place in the C3 vertebrae below, get that measurement. We're going to place that at 50 degrees for our purpose here today. And we're going to take that angle arm, place it on the headpiece with the 0-0 line parallel to the base of the headpiece, and set our training string for the stance line perpendicular to that 50 degrees. So here my shoulders and my hips are parallel to the 50 degrees. My stance line is a scissored stance, making it so my episternal notch can be directly over the lamina of the C2 vertebrae. The bone is shifting up in this direction. I'm going to be contacting the left lamina and pushing the bone back down into position. I'm going to do so by getting my episternal notch directly over the contact. With my inferior hand, I'll take a tissue pull coming directly down that 50 degrees, anterior to posterior, superior to inferior. And then I'll bring in my contact hand so that my ulna is directly parallel with the stance line of the 50 degrees. From there, cock the table, bring in my stabilization hand without wrapping the thumb, and there's a 90 degrees superior torque bringing the elbow into the body. I should end up with my episternal notch, piezoform, and left lamina of C2 in one direct line from one another.